The COVID-19 pandemic, caused by the novel coronavirus SARS-CoV-2, has left an indelible mark on the world. Millions of people have been infected, resulting in a significant loss of life. The virus has impacted nearly every aspect of our lives, from our social interactions to the global economy. While the acute phase of the pandemic has subsided, we are now grappling with its long-term consequences, one of the most pressing being long COVID. This condition, also known as post-COVID syndrome or PSC, affects a significant portion of individuals who have contracted the virus. It is characterized by a wide range of symptoms that persist for weeks, months, or even years after the initial infection is cleared. Long COVID represents a significant public health concern, impacting individuals' physical and mental well-being, as well as placing a strain on healthcare systems worldwide. In this essay, we will delve into the complexities of long COVID, exploring its symptoms, diagnosis, treatment options, and the latest research findings. Our aim is to provide you with a comprehensive understanding of this often misunderstood condition and empower you to seek appropriate care and support. Long COVID is a complex and multifaceted condition that has baffled both patients and healthcare professionals alike. It is a stark reminder that the impact of COVID-19 extends far beyond the initial illness. While some individuals recover fully from COVID-19 within a few weeks, others continue to experience a constellation of debilitating symptoms long after the virus is no longer detectable in their bodies. The significance of long COVID cannot be overstated. It affects individuals of all ages, backgrounds, and health statuses, potentially leading to long-term health complications and reduced quality of life. Furthermore, the economic and social implications of long COVID are substantial, impacting workforce productivity, healthcare costs, and overall societal well-being. Understanding long COVID is crucial for developing effective treatment strategies, supporting those affected, and mitigating its long-term consequences. By shedding light on this enigmatic condition, we can raise awareness, reduce stigma, and pave the way for improved patient care and research breakthroughs. Long COVID, also referred to as post-COVID syndrome, PCS, or post-acute sequelae of SARS-CoV-2 infection, PSC, is a condition characterized by symptoms persisting for weeks or months after the initial infection. The World Health Organization defines long COVID as symptoms lasting at least 2 months not explained by an alternative diagnosis. It is important to distinguish long COVID from acute COVID-19. Acute COVID-19 symptoms usually resolve within a few weeks. Long COVID can affect multiple organ systems and persist much longer. Studies estimate that 10 to 30% of COVID-19 patients experience long COVID. This affects millions worldwide, with risk factors including older age, female sex, and severe initial illness. However, long COVID can affect anyone, even those with mild or asymptomatic infections. Long COVID is a highly variable condition, with individuals experiencing a wide range of symptoms that can affect multiple organ systems. These symptoms can fluctuate in intensity and duration, often appearing in clusters or patterns. While some individuals may experience only a few mild symptoms, others may present with a debilitating combination of symptoms that significantly impact their daily lives. Among the most commonly reported long COVID symptoms are respiratory, shortness of breath, persistent cough, chest pain, neurological cognitive impairment, also known as brain fog, headaches, dizziness, difficulty concentrating, memory problems and sleep disturbances, cardiovascular heart palpitations, chest pain, postural orthostatic tachycardia syndrome, POTS, fatigue energy, persistent exhaustion, post-exertional malaise, PEM, gastrointestinal nausea, diarrhea, abdominal pain, loss of appetite, changes in taste or smell, mental health, anxiety, depression, post-traumatic stress disorder, PTSD-like symptoms. In addition to these common symptoms, long COVID can also manifest with less frequent but equally debilitating symptoms, such as joint pain, muscle aches, skin rashes, hair loss, and menstrual irregularities. The variability in symptom presentation highlights the complexity of long COVID and the need for personalized treatment approaches. Section 5. Diagnosing the invisible. The challenge of long COVID. Diagnosing long COVID can be challenging due to the lack of standardized diagnostic tests and the wide variability in symptom presentation. Currently, there is no single test that can definitively diagnose long COVID. Instead, healthcare professionals rely on a combination of factors including clinical history. A detailed medical history, including the timeline and severity of COVID-19 symptoms, is crucial in evaluating for long COVID. Physical examination. A thorough physical exam can help rule out other potential causes of symptoms. Laboratory tests, blood tests, imaging studies such as chest X-rays or CT scans, and pulmonary function tests may be ordered to assess organ function and rule out other conditions. Symptom questionnaires. Standardized questionnaires can help assess the presence and severity of long COVID symptoms. One of the biggest challenges in diagnosing long COVID is that many of the symptoms are subjective and cannot be objectively measured. Fatigue, brain fog, and pain, for example, are real and debilitating symptoms but can be difficult to quantify. This highlights the importance of patient-reported outcomes and the need for healthcare professionals to listen carefully to their patients' experiences. Another challenge is that long COVID symptoms can overlap with those of other conditions, making it difficult to tease apart the underlying cause. It's essential for healthcare professionals to consider other possible diagnoses and rule them out before attributing symptoms to long COVID. Navigating the road to recovery involves a multifaceted approach that addresses each individual's specific symptoms and needs, helping manage the condition and improve quality of life. Treatment strategies often involve a combination of lifestyle modifications, symptom management rehabilitation therapies, mental health support, and nutritional support. Lifestyle modifications may include making adjustments to daily routines, such as prioritizing rest-pacing activities to avoid post-exertional malaise and engaging in gentle exercise as tolerated, which can be helpful in managing fatigue and other symptoms. Symptom management might involve medications prescribed to address specific symptoms such as pain relievers for headaches and muscle aches, antidepressants for mood disorders, and inhalers for respiratory symptoms. Rehabilitation therapies like physical therapy, occupational therapy, and speech therapy can help individuals regain physical function, improve cognitive skills, and adapt to limitations. Mental health support through psychotherapy, support groups, and stress management techniques can be beneficial in addressing the emotional and psychological impact of long COVID. Nutritional support, including a balanced and nutritious diet, can support overall health and well-being. Some individuals may benefit from working with a registered dietitian to address specific dietary needs. It's essential for individuals with long COVID to have access to healthcare professionals who are knowledgeable about the condition and can provide comprehensive and compassionate care. Scientists around the world are working tirelessly to understand long COVID and develop effective treatments. Current research explores viral persistence, immune dysregulation, autoimmunity, microclotting, and reactivation of latent viruses. One theory suggests remnants of the virus may persist, triggering an ongoing immune response. Long COVID may also be caused by an overactive immune response, leading to inflammation and damage. COVID-19 infection might trigger autoantibodies attacking the body's tissues. Some studies suggest long COVID is linked to tiny blood clots disrupting blood flow. Additionally, COVID-19 may reactivate dormant viruses like Epstein-Barr, contributing to symptoms. Clinical trials are evaluating the safety and efficacy of various treatments for long COVID. Antiviral drugs like Paxlovid and Molnupiravir are being investigated to eliminate persistent virus and reduce inflammation. Immunomodulatory therapies, including corticosteroids and monoclonal antibodies, are being studied to dampen the overactive immune response. Anti-inflammatory drugs like NSAIDs are being explored to reduce inflammation and alleviate symptoms. The NIH has launched the Recover Initiative to study long COVID and accelerate new treatments. The Recover Initiative is a multi-year nationwide effort involving thousands of patients and researchers. While long COVID presents significant challenges, there is reason for hope. As research progresses, we can expect advancements in diagnosis, treatment, and prevention. Future care may include biomarkers, personalized medicine, novel therapies, and long-term monitoring. Identifying specific markers will enable earlier diagnosis and targeted treatment. Tailoring treatment to individual symptoms will improve outcomes. New drugs and therapies targeting long COVID hold great promise. Long-term monitoring will track symptoms, identify complications, and evaluate interventions. Addressing the social and economic impact of long COVID is essential. This includes funding for research, improved care access, workplace accommodations, and public awareness campaigns. Continued investment in long COVID research is vital for effective treatments and prevention. Ensuring access to specialized clinics and support services for all affected individuals is paramount. Implementing workplace accommodations will enable individuals with long COVID to remain employed and engaged in society. Raising public awareness will help reduce stigma, encourage early diagnosis and treatment, and promote understanding and support for those affected. Long COVID is a complex and evolving public health challenge that requires a collective effort to address. Each of us can play a role in supporting individuals with long COVID and advocating for research and policy changes. Here are some ways you can make a difference. Educate yourself about long COVID, its symptoms, and available resources. Share accurate information about long COVID with your family, friends, and community to help raise awareness. Offer support and understanding to individuals with long COVID by listening to their experiences, validating their concerns, and connecting them with resources. Contact your elected officials to urge them to prioritize funding for long COVID research. Advocate for policies that improve access to care, provide workplace accommodations, and support individuals with long COVID. Connect with others who are affected by long COVID through online or in-person support groups. By working together, we can raise awareness, advance research, and improve the lives of those living with long COVID.